You're back with the second half of today's edition of our show. Dr. David DeRose with Michael Stocker, or should I say Dr. to be Michael Stocker, third year medical student, who's been sharing with us his journey. Really, I mean, you've had an amazing journey. You're getting experience, you've gotten experience in a lot of areas that many physicians, even who go into public health, don't have for many years. I definitely did not have that kind of experience going into medical school. You had worked with Indian Health Service. You've worked closely with Native partners throughout the Albuquerque region there at IHS. But your exposure to public health and your exposure to working with Indigenous peoples did not start in the Americas. Tell us a little bit about how you ended up in Africa and where you were at in your life course, if you will, at that point.
Absolutely. So I had just finished my undergraduate degree, and my father had been tapped. He was a teacher by trade when he came out of his undergraduate degree, and he was invited to go to Liberia, Africa, with a group called Hope 2. At the time, it was Hope 2 Liberia, a mission organization that was going to be holding a teachers conference, essentially helping Liberian teachers learn how to put curriculum together and to be able to run a classroom effectively. So I was invited to come along with my dad to that trip and to teach public health concepts. Essentially, how do we teach kids in the classroom to have good hygiene, how to wash their hands properly, and sort of things like that. It happened to be in 2014, the summer of 2014, right before the Ebola outbreak really became big, hot world news. It was definitely going on when we got there. We fortunately didn't have a lot of exposure to it directly, but I will say I did not come prepared to answer Ebola questions when I got there, but I sure gave myself a crash course because every single day, Liberian teachers and Liberians would come in and say, hey, what is this Ebola thing? How do we prepare for it? How do we prevent it? What is it? So fortunately, I'd had a great undergraduate training in virology, so I'd been able to educate myself quickly. But it was my first crash course in both missions as well as in public health and communications.
Yeah, this is an exciting story. And of course, you know, Michael, I wrote a book some years ago called Evading Ebola. And this is not a sales pitch for the book because we've been actually since the COVID-19 outbreak giving this book away free. I'll mention how any of our listeners could get a free copy if they're interested. But Evading Ebola, I'm just looking at the publication date, 2014, came out in that very same context. I was doing the same thing as you were. A little bit later, a few months later, I was saying, we got to look at this data and get some educational material out. There were great fears that Ebola was going to be setting up perhaps shop here in the US. What was so fascinating to me, and of course now we talk about this topic and people yawn, but before COVID-19, most Americans, most people in the world had never heard of inapparent infection. They'd never heard of well, let's put it this way. They've never heard of someone having an illness but not being sick. What was so fascinating to me, and I don't know if you came up with this literature, Michael, but the foundation for this book was that as I looked through the medical research literature over a number of years, we found there was compelling evidence that many people in Africa had contracted Ebola. Blood tests showed that they had been exposed to it, but they had no awareness that they had ever been sick. And that really just got my mind working, you know, saying, well, what was it about the immune systems of these people or their exposures that allowed them not to contract the illness? And so the title of the book, Decrease the Risk of Infection, I mean, that's especially focused on the kind of things you were teaching, you know, hygiene, public health, frontline stuff, but fare far better if exposed. And we were talking there about lifestyle factors that can impact immunity. Of course, we couldn't connect all the dots, just like we today with COVID-19. We can say we know certain things improve the immune system, but will it really help you have a less severe COVID-19 infection? Well, we're starting to get some answers, but I just find it a fascinating topic. When you were studying Ebola, did you walk away with other practical lessons that have transferred into other areas for you and in your work now as a medical student?
Well, I think an important piece from Ebola, and it actually I think translates well to what we see with COVID, and that's making sure that the communication lines are clear and that good public health information is available to people all over the affected areas and potentially affected areas. That was something that I found to be particularly difficult in Ebola. I wasn't on the ground for very long in Liberia during that time. Once infection rates really started taking off, and we were told to leave the country. Uh, but one piece that I found fascinating was that there was a lot of distrust with the message that was being put out about Ebola in Liberia, and that led to a lot of precautions not being taken by the general population. And while that distrust in government is something that's hard to overcome, as health practitioners, being able to tell one-on-one with a patient, here's what you can do to help yourself avoid this infection and avoid this epidemic. I think that's a sacred relationship that we have to take a lot of pride in maintaining as public health professionals and also as physicians.
Yeah, I appreciate this so much because if you're listening today from Indian country, whether you're a nurse, whether you're a community health worker, whether you are a tribal elder, anybody that has any stature in the community, credibility, what I hear Michael saying is leverage that credibility into actually teaching best practices when it comes to important public health messages. Because let's face it, in today's world, you can find on the internet basically any message you want, and all the people seem to be equally credible. If if you're a lay person, I mean, how do you know which doctor or which quote expert is telling you the truth? But when you have a personal relationship with someone, that goes a long way. So is that the message you're trying to communicate, Michael, or am I taking it a little too far?
No, I think you hit the nail on the head there, and I think something important, especially that we've learned in COVID, is that things might change over the course of a day or a week or a month as new research comes in, and that was certainly the case with Ebola, as we learned more about that disease and how it affected the human body and how it transmitted from person to person. And I think we'll continue to learn more things about COVID, and what we might teach today about how to avoid it might not be exactly what we're teaching in a year or 2 years or a decade from now when it's showing up on my board exams. But I think this is an important message that we have to digest the most relevant and most recent information and distill it in a way that is useful for our patients and our community.
And here's the take-home message, at least one of them that I come across from my perspective that I'd like our listeners to really grab hold of. And it's this. You've heard Michael sharing what we know in the healthcare community, and that is that medicine is an evolving science. And because of that, well, it can be leveraged against us. People can say, oh, doctors don't know what they're talking about. And at the end of the day, you can say, well, I'm just going to do whatever I'm doing. I'm not going to change anything. But this is not following best practices. If you follow the best practices when it comes to health information, you're going to put yourself in the best position to live longer and better. And yes, it's true. We don't always get everything right. Hindsight is 20/20. But I'll tell you, there's a lot of people that are suffering, a lot of families that are suffering today because they didn't follow what best practices were, whether we talk about Ebola or whether we talk about COVID-19.